Let's do a quick video on arm and antecubital fossa. Let's hide some of these muscle here and get to the goods. So I like of thinking of the arm largely into anterior and posterior compartments. The things on the anterior side largely do the same thing. The things on the posterior side largely do the same thing. There's some shared innervation patterns, and there's also some rules to exception. So there's a lot of testable nuggets in here. To start off with, let's do the biggest muscle. That is the most superficial. That's going to be biceps brachii. Sometimes we get very conflicting information about, what bony landmarks are testable and which ones aren't. I would say biceps has an origin that's very testable and insertion as well. The coracoid process, or that C-like projection that comes off the scapula, has three things that attach to it. It has pec minor, it has short head of biceps, and it has another muscle we'll talk about in a bit. So that's one of the ones that's always worth knowing because we can easily show it on x-rays on the human body. We also have so we have our short head here. We also have our long head of the biceps. And the way I remember the two of them is the long head goes round the outside, round the outside, round the outside. And we can see it attached to the supraglenoid tubercle of the scapula. So sitting above that glenohumeral joint. As we follow both these down, however, it's worth noting that they terminate on the radial tuberosity. And the radius is the bone that facilitates kind of the log rolling we can see with the forearm there and the motions of pronation or supination, or pronation or supination. And the biceps, being a very powerful flexor of the forearm, or flexor about the elbow joint, is not the only thing that it does. It actually contributes to supination. And I always remember that because when I put my hand on my bicep and I go from pronation to supination, I can feel my bicep activate or shorten. So that's one of the things to remember. The testable nuggets on the bicep are going to be coracoid process, radial tuberosity, and because it attaches the radial tuberosity, it can also help with supination, or it has a motion about the radius. One of the other things that we got to remember on it, though, is that it's innervated by musculocutaneous nerve. That's going to be one of the major nerves that is going to be one of the five things in brachial plexus I want you to know. There's three nerves that go all the way down to the forearm for their motor contributions. There's two that leave pretty early. Musculocutaneous leaves the highway pretty early is the mnemonic I use when I'm kind of in anatomy lab showing you guys. Axillary is the other one that leaves pretty early. We'll talk about that nerve a little bit more when we get a little bit deeper. So as we hide this, we can actually see musculocutaneous nerve, and we can see it penetrating through this other muscle here, which is going to be the third, or our trilogy piece here for muscles that attach to the coracoid process. And that's going to be Coracobrachialis. It's convenient having nice names there sometimes. What does this muscle do? And this is the thing we got to kind of lock in on here a little bit. It might be easy to make a generalization that everything in the anterior arm is going to be a flexor about the elbow. That's only true if it crosses the elbow, of which this muscle does not. It goes from coracoid to about mid-humerus there. And for a muscle to have an action at a joint, it has to cross a joint. So this one does not. What joint does it cross? It crosses the shoulder joint, so it can help us with shoulder flexion and adduction as well. However, this muscle does not cross the elbow joint. That is a bait question they like trying to trick you on in labs. If I tag this muscle right here and I give you an option that says, what does it do? And one of the options says flexes about the elbow. Wrong. It doesn't cross, so it can't do it. And then just once again, appreciating musculocutaneous nerve, one of the five distal motor branches coming off brachial plexus I want people to remember. It's worth knowing that it has motor components in the arm, and most of the things it does beyond that are going to be sensory, like sensory to portions of lateral elbow. How about? So there's another muscle out of the way. We got another one down here. Once again, we kind of are hammering that muscles have to cross a joint to have an action about it. Well, this muscle, brachialis, definitely does cross the joint. Therefore, it's going to be a flexor about the elbow. Another thing to take note of here, it doesn't attach to the radius, it actually attaches to the ulna. And the rotation happens about the radius, so this one's not going to do too much for us for pronation and supination. But what is the testable fact about this muscle? And the testable fact is that it has dual innervation. Like the other muscles of the anterior arm, it's innervated by musculocutaneous nerve. But it's also innervated by radial nerve as well. So I think one of the favorite trick questions people like asking is, let's say your musculocutaneous nerve is toast, doesn't work. How could I still flex about the elbow? And there's two parts to that answer. One being brachialis, which contributes to elbow flexion, is partially innervated by radial nerve. That's one way. And then another muscle we'll talk about, brachirad, also receives innervation from radial nerve as well. So brachialis, another flexor of the elbow. But the thing that's worth knowing is it's dual innervated and it attaches to the ulna, so it doesn't really participate in pronation and supination. What about the last one? Well, I need one more muscle here that's going to help me participate in elbow flexion, and that's going to be brachirad. So it's going to attach kind of distal humerus and terminate on lateral distal radius. And it crosses the elbow joint. Therefore, it has an action about the elbow joint, albeit it's not the most powerful flexor. It participates in elbow flexion. Doesn't generate the best torque starting down here at the distal humerus, but it still contributes. But what is worth knowing is it is entirely innervated by radial nerve. So now I have two muscles that can participate in elbow flexion that are innervated by radial and not just musculocutaneous nerve. All right. One of the other things I think is worth talking about as we get here, kind of into this antecubital fossa here, is we have biceps brachii, and eventually we'll have the tendon of it, which we talked about a little bit earlier. But it is worth knowing that we have a neurovascular complex that passes pretty close to this tendon here. Some people use it mnemonic, where it's called TAN, or tendon artery nerve. I like that one because it helps me keep things straight. So let's hide this here. And when we talk about that, mnemonics orientated laterally to medially, and is going to be the tendon of the biceps brachii, then the brachial artery, and then the median nerve can all be appreciated close to each other in a lateral to medial arrangement. This is worth knowing when we're dealing with structures around the biceps tendon, and it also sometimes can help us distinguish between those two structures. So to finish this off here, let's talk about the posterior compartment. Whereas the biceps is going to be the powerful flexor about the elbow, the triceps is going to be the powerful extensor about the elbow. Just like biceps has two heads, triceps is going to have three heads. So the first one we have is going to be the lateral head, of which the medial head is a little bit deep to it. And if we show it this way, we can appreciate a slightly more medial arrangement with it, with this one being the lateral, leaving the other one to be the long head of the triceps. Whereas the anterior arm has some predominance to musculocutaneous nerve for motor innervation. The posterior arm is dominated by the radial nerve, which comes off the posterior cord, innervates the posterior arm, and also innervates the posterior forearm. So that naming convention is going to really help us as we keep going down. Well, can I actually see that nerve? You betcha. It's right there. So it's kind of taken a dive off that posterior cord, and it looks like when we're in the actual cadaver lab, it looks like it's heading between the bellies of the tricep as it distally paths posteriorly. We can also see it form a neurovascular bundle with the deep brachial artery as it descends backwards. So let's hide some heads here. And we can see the neurovascular bundle as it paths down. Now we really only have one more muscle to talk about, and that's going to be Anconeus. It crosses the elbow on the posterior aspect, so it is going to be an extensor of the elbow. It's not a very big or a beefy muscle. It's more of a like feel it with your fingers as opposed to grab it in your hands type muscle. We can appreciate it down here, just like the triceps and the posterior arm is dominated by the radial nerve. This bad boy here is also going to receive innervation from the radial nerve. So that's really all we have for muscles. The only other thing that I wanted to talk about quick was veins. As we path down, this is what I like to call our bodybuilder vein, as we can see that on some of the gentlemen as they're hitting their front chest poses there. And it paths between the pec and the deltoid. That's going to be the cephalic vein, pathing anteriorly about the shoulder joint and laterally as we descend down the arm. We also have the basilic vein, which is going to occupy more of the medial arm. And then lastly, we are going to have a brachial vein that kind of splits the difference between them, where we also have the brachial artery. So that's really all I got. Mari wanted to join and say hi today, but I'll see you guys in lab.